This program is brought to you by Breining Institute, which has provided higher education, training, testing, and certification for addiction professionals since 1986.
Good morning, everyone. My name is Warren Daniels. I'm the Chief Executive Officer for Community Recovery Resources. We're based in Nevada County, California. I'm here at Breining Institute today to do a workshop on the 12 core functions of addiction counseling. We're also going to discuss the TAP-21 and the importance of understanding these two processes as you deliver services to your clients, so that what they experience is seamless service delivery. But it's very important that we understand each of these processes very well, so that our client has the best quality treatment experience possible. At Community Recovery Resources, we focus on a multidisciplinary level of care, focusing both on addictions and related behavioral health issues. We deal primarily with the family, but we also work with individuals as well. You can find us on the internet at www.corr.us, and hope you enjoy the workshop today. And we're going to work on just understanding the 12 core functions and exactly how that relates to what you do in your day-to-day duties as a drug and alcohol counselor. We do a pre-test. I try to keep it as simple as possible, but just kind of for you to get kind of an idea of what we're going to be, the information we're going to be working on. So the first one is how many practice dimensions are identified in TAP-21. For those of you who have been to school, or even for those who haven't, who just ended up working in the profession without going to school. You maybe you're looking forward to going to school. The TAP-21 is a common book. Maybe there's 20 dimensions, maybe there's only 2, I don't know. Do you? There's 8 practice dimensions in the TAP-21. Okay. In the TAP-21, which of the 12 core functions parallel with practice dimension 1? Intake. Right. When was the latest revision to the TAP-21? I think 05 was the last revision. There has been there's been a supervisor TAP that's been created since then called TAP-21A. But 2005 was the last time there was a revision. And why were both the TAP-21 and 12 core functions created? Public protection. Although both the TAP-21 and the 12 core functions serve 2 completely different purposes, and were created for 2 different purposes, they were created to protect the public, to create a levels of knowledge, skills, and tasks that would provide competency-based services, so that when you were talking to somebody about how to sew their jacket back together, you understood the basics of how that jacket was put together and why it needed to be sewn that specific way. So it's about protection of the public. Okay, so we got through the pre-test. That wasn't too grueling. Because it's important that you understand these. Okay, it will help you provide quality care. It will help you enhance your employability, okay? Because I'm an employer, and I know when a counselor comes in and talks to me and interviews with me, I ask them what they know about the 12 core functions. That's one of my questions. Tell me what you know about the 12 core functions. And if they can talk to me about the 12 core functions in a way that appears to be understandable, and I believe that they really know the information, they've got a lot better opportunity of getting that job than somebody who doesn't. Why? Because it's less training. I'm going to be able to move that person into a position. They're going to be able to pick up a caseload. It's an automatic given that they have a good level of empathy and engagement, or they wouldn't be in the profession because they're already registered or certified. If they come to my facility, they are already certified, and it's going to make that transition that much easier. So learning this stuff, learning how to put it into practice, enhances your employability, and also enhances your ability to provide a continuity of care for your clients, and safeguard all of the treatment decisions that go into a treatment episode with the clients that you work with. So let's see, we'll get this thing going here. So we did, well, Mike introduced me. You know, I think what I can say about, you know, just a couple more things about myself. I started Breining Institute in back in the 1900s. That's what it feels like sometimes. It's funny, I don't think I've said that before. And I got my certificate in counseling here, and then went on and got my bachelor's degree, and added, as you saw, there were a couple other acronyms behind my name. Have added, spent a period of time as working on being an overachiever. I'm very much into public protection, providing quality services to the people I serve. So in my earlier career, when I started this stuff out, I was like a sponge. And there are probably a half a dozen credentials I have that I didn't even put up there. So, you know, today I work up in Nevada County. I work with Community Recovery Resources. We're a small little program up there. We got a county population of about 100,000. On any given day, we have about 1,000 people enrolled in our programs. We provide services from criminal justice to outpatient to detox, residential, transitional living. We have a staff of about 47, depending on what day it is. We work in the schools. We work out in the streets in the community. We do outreach work. We provide on-site treatment services. We employ a staff physician who is ASAM certified doc. We employ MFTs. We employ child care, child development specialists. We provide support staff. And it takes all of those people to provide a treatment episode. You know, gone is the day where you can just go to one person and get one thing done. Of course, there are those that are in private practice, and that works for a percentage of the folks. And we provide a lot of referrals to people in private practice as well. We work on stabilization and getting people back into the mainstream of life. That's really what our focus is. We like to focus on the family system wherever possible. We do provide both care for both adolescents and adults. That's a little bit about me. So today we're going to work a little bit on the TAP 21, just pretty much, you know, I'm going to go through that pretty quick, but we're really going to dice up to 12 core functions. So hopefully when you walk out of here, a couple of things have happened. One, you're like, wow, I had no idea. You know, I think if there's one thing I would really like to see is that you have that experience. Two, that you have a desire to want to know more about this. And three, that it drives you to doing more research on your own about this process. And you'll continue learning about this process until it becomes like riding a bicycle. How many people in here ride a bicycle? How many people in here rode a bicycle as a child? Okay. My point is that once you ride a bicycle, you know, it might be a little shaky after not being on it for a couple of years, but when you get on that bicycle and you start going, it comes back to you like that, you know. And learning the 12 core functions is very, very similar, if not exactly like that. So, we'll talk about that. We'll do a little post-test. Understanding internship. I know some of you may be in internship, so we can talk about that. If you have questions about certification, I know a little bit about that. Certainly Mike and I can discuss that with you. It's an extremely important process in somebody's career. And so,